Good afternoon, Africa, and welcome to Shaping African Conversations. I will be your co-host today, Joyce Maina. Our host is slightly indisposed. She could not make it into studio, but she will be joining us virtually from home. So welcome, Tamima.
Well, thank you, Joyce. Thank you so much for joining us this week on Shaping African Conversations. Remember, every week we're here having fantastic conversations around how COVID-19 has affected us on the continent. And this week we're just going to be focusing on your health. We're going to get to know more about this disease. We're going to be talking to some health practitioners who will really be giving us the reality. What are the symptoms, treatment, what are the developments when it comes to the race towards getting a vaccine? And of course, just hearing from our other guests from across the continent around what the situations are like in those countries.
Yes. Okay. And let me just go right ahead and introduce our panelists. We have Tomisin Ojo, who is a media personality, TV presenter, and talk show host of MTV Nigeria. Welcome.
Hi, Joyce. Good to be here with you. My name
Yes.
is Tommy. I need to do some Yoruba lessons.
Please do. I'm sorry. Like, I apologize in advance for butchering your name.
But don't worry. My name is Tommy, and from MITV, and it's good to be with you again this week.
Fantastic. Thank you so much for joining us. On our panel as well, we do have Gathoni Mbogwa, who is a clinical psychologist at Chiromo Lane Medical Center. Welcome, Gathoni. Oh, could you unmute your video? We can see you, but we can't hear you, Gathoni. Oh, sorry, your audio, not your video.
Hi, sorry about that.
It's okay.
I'm excited to be here. Thank you.
Yes, thank you so much for joining us. And of course, our experts today, we will be having Dr. Simon Kingondu, who is the Secretary General of the Kenya Medical Association. Hello, Simon.
Hi, how are you?
I'm good. How are you doing?
Yes, I'm also an obstetrician gynecologist.
Mm-hmm.
I see women.
Oh,
Women.
thank you for sharing that very important
And
bit of
we are
information.
also in the national COVID task force.
All right. Thank you. I'm
We are
sorry
also
for
in the
removing from
national
your
COVID
credentials.
task.
Okay, we also have Dr. Mwachonda, who is the Secretary General of the Kenya Medical Practitioners, Pharmacists, and Dentists Union. Welcome. There's a bit of a mouthful. Let me just say KMPDU.
Okay, that's fine, man. Thank you.
Is that how you introduce yourself? Do you say the whole thing or do you just say KMPDU?
Kenya Medical Practitioners, Pharmacists, and Dentist Union is in full, but I think KMPD will suffice mostly in our country. But if you're talking to people from other countries, it will be good to specify it in full.
All right, thank you so much for joining us. And we also do have Kamar Guled, who is a paramedic and also a representative of E+, who will be joining us later. So guys, on today's topic, we will be talking about how COVID-19 has become practically the new normal. So with it being our new normal, we would like to know what are the safety protocols and various businesses and organizations should put in place to ensure that the sense of normal is resumed. I think I will start with you, Tamima.
Okay, so I think in the context of opening up, so you've seen, I think last week we had a conversation around the fact that most economies are now opening up.
Yes.
And I kind of feel like, and especially if you look at Kenya right now, I was in town like a couple of days back, and it seems like life is back to normal.
Yeah.
There are those who have masks, there are those who don't have masks. And that whole thing about physical distancing, it seems like it's just something that is being pushed on TV, but in reality, on the ground, things are very different. And that's really why this week we chose to actually just have a discussion around the health and safety, because in as much as we are trying to define what our new normal is, and life is slowly going back to that some semblance of normal, we cannot disregard the fact that the pandemic is still here with us, and there are still some health and safety concerns that each and every one of us has to be responsible for.
Dr. Simon, would like to come to you as well. Kindly unmute your audio. We can't hear you.
So sorry about that. That happens a lot in technology. Yeah. Thank you very much for having us discussing this very important topic. And it's good you're having the health professionals in place because for so long the health has not been given the relevant importance that it alluded to. And COVID-19 has actually revealed the underbelly of our life, actually, literally. So I think what we is that health is life, health is the economy. Health, you don't have the economy coming before health. Therefore, the health practitioners finally are taking the position they're supposed to take in this situation, so to speak. So I think in future, when the health professionals speak, COVID has revealed that you need to listen to them and take into account what they're saying.
Thomasin, I know you've heard Tamima mention how things are back, well, kind of back to normal in Kenya. How are things in Nigeria? Are people taking this health protocol seriously, or is it business as usual?
Okay, thank you very much, Joyce, for that question. In Nigeria here, people are back to normal. Relatively a little bit of improvement from last week because you see the security officials that man the roads have been instructed to arrest those who do not wear the face mask, especially those in commercial buses and those commuting from place to place. So on the streets, on the major commercial streets, you see that there is that measure of enforcement, but the people still find a way, to just sneak around and pretend some people in a bus. I intentionally went out and I took a bus just to be able to communicate with people. So what happened was the guideline is that you, in a commercial bus, you have one passenger in front as against the two that we used to have. You have two per row rather than the four which we used to have. So I was in this bus. I made sure I got a front seat. I was the only one. I was wearing my mask. But upon the arrival of other passengers, the guy wanted to take 2 each, but the passenger started fighting him. And they wanted all to, fill up the bus. And then they started with conversations like, it's a lie. The government is just lying to us. There is nothing like COVID. It's the problem of the rich and all of that. And, that for me has revealed that our people are still greatly, grossly misinformed.
Yes.
And the political undertone that you see there is this, they still feel that this is a political gimmick that the political class are using to tie them down or rob them of something. What they're robbing them of, I think it's about time we begin to have conversations around the local heads, the community leaders, the religious leaders who usually have the voice whom these people listen to. We need to come into this conversation and educate them better.
All right. Dr. Machonda, Dr. Kingondu did mention that, when doctors speak, people need to listen, but also Thomasin has just mentioned how when it comes to like the lower class people, they really don't believe that COVID is a problem. So how do you go about talking to them about this and reinforcing the fact that they still need to take these safety precautions seriously, even though the economy is quote unquote back to normal?
Yeah, so basically where we are at with regards to this issue, especially those who are really trying to survive, because the problem is that in Africa, most of our governments have had poor social protection measures, and our governments are not really welfare states. So people have been pushed to a point where they're looking at their own survival with regards to getting food and perhaps even getting their usual activities that give them their economic empowerment. So as a result of that, then they have quickly now decided that we just want to move on in our lives. COVID is not really affecting us. And so that means that the ministries of health and the governments across Africa then have to take the initiative to ensure that they actually educate the people. Educating the masses doesn't mean we use force, because using force, you're bound to push people to a corner and they might react back to what you're trying to achieve. And so the best way is to keep on the messaging, to keep on influencing, using community leaders in these communities and the society to able to ensure that people listen to the message and they get the message right.
All right, thank you so much, Dr. Machonda, for that. Tamima, do you have any questions about this particular topic to our panelists?
I think first off, because we are on Facebook, just remind anyone who's watching us via the live stream to remember that you can ask any questions that you may have. So if you have any specific questions, feel free to reach out to us via, of course, the comment section. Let us know what your specific questions are. And I just want to engage everyone on here, because we are talking about opening up. I recently came across a thread on Facebook, and basically it was almost a bit of a parody. People were now making fun of the fact that, do you know of someone who has had COVID, who has been treated for COVID or recovered, or who has died from COVID? And what I saw in the comment section really just displayed the level of apathy that a lot of people now are having towards this disease. Because you heard what Tommy said, that in Nigeria there's a perception that this is a rich man's disease. So in the context of it being a pandemic, we are seeing the numbers and the incidences in other countries. For instance, the world saw what happened in Italy. We are seeing that the USA now has, infections in the millions, whereas here in Kenya we are talking about 3,700 plus infections. We've had right now, I think, 104 deaths. So what would you tell anyone who feels like this disease is not real? It's just something that you see in the TV. And I'm going to throw this to you, maybe Simon.
Thank you very much for that question. I think we have taken the right path in terms of listening to the experts who are the medics. And in Kiswahili they say, ukiona mwenzako amenyolewa,
kichwa kitie maji.
So the spread of the pandemic, and we could clearly see it in terms of was reported in Wuhan, China, and we saw the way it was spreading to Italy and then America and the US. The fact that maybe we haven't seen people falling down does not mean that it just probably it was a delay pandemic. It came later. So I think it's too early to actually and of note is that of deaths reported associated with COVID has reached 100. When 100 people die, then you really need to ask yourself whether you have a pandemic or not. So I think we are just looking at the facts and following, just taking precaution of the same.
Okay, so maybe just as a follow-up question to that, because we know that on one hand, our numbers may not come across as that high in comparison to numbers we're seeing in other countries, but especially for the young people in the country, because the reality is that we do have a lot of people who feel like, and we've had the jokes, I'd rather die, I will not die of hunger, ugonjwa kama ugonjwa ingine. So perhaps in the context of that, what is the most important message that people have to remember about this disease? Because famously, we had the saying that if you treat this disease normally, it will treat you
abnormally. Yeah.
Now, And there's all this anger that you're telling us, guys, tukae kwa nyumba, you're arresting us, we can't go for funerals, we can't go for weddings. Yet we're seeing that the very political class, they're flouting all these rules. So in the context of that, right now we are in June. We are now, we've had all the comments that Kenya is going to get into a peak, should I say, infection rate around August. Yeah. So what does that all mean, especially for me, who's just trying to live my life, earn a living, and basically just be happy? Let me throw that to Machonda.
Basically, I think the most important thing is that you, as a leader, you need to lead by example. And what we've seen in Kenya, the instances that we've seen so far is that the leaders have failed to some extent to show that the message that you're trying to pass is what needs to be done. So essentially, if the leaders do not lead by example, by wearing face masks in public, by showing that they're actually practicing social distancing, the 1 meter apart rule, I mean, then it becomes very difficult for a population that is feeling socially and socio-economically deprived of their right to economic activities and not understanding the link between the disease and the activity. It becomes a very difficult scenario. So the first thing would be that the leadership actually has to, what you'd say, to practice what they preach. That should be the first step. But of course, even with that, and I'll still say this again, is that the masses so the government needs to also put in place measures to protect socially those who are vulnerable. And by this, I mean that then perhaps we've seen an initiative that is yet to be implemented on ensuring that those who are lost jobs during this COVID-19 pandemic are able to be given some form of of stipend for upkeep and for provision of basic necessities of life. So that would be the second thing. And of course, the third thing is to now not use, because what we've seen so far also has been a lot of use of excessive force in trying to enforce the mitigation measures. Then perhaps would be not to use too much force, but also to try and educate the public, engage the communities, talk to the community leaders, talk to the community groups that are able to influence the community to understand. And I think with that, they would be able to try and some way reduce this narrative that is currently going through.
And probably just to shout out anyone who's joining us here on the live stream. I'm seeing some comments on Facebook. We have Rebecca Mora, you're tuned. Emily Kang, you're tuned. Salma Olo, you're saying you're tuned. Masi Kawira, you're watching. Bonjarito, you're watching. Vincent Mudarimi, you're watching. Thank you so much. We have someone all the way from Saudi Arabia as well. So remember, if you have any questions about this disease. So, and again, we have Gadoni, who is also in this particular episode with us this week. Gadoni, you had something being mentioned earlier around just the psychology, because we are reaching a point where we are seeing it. Even myself, I'm guilty of it. There are times I don't walk around with my mask. I think most of us here will admit we are all guilty of it. I'm not washing my hands as frequently as I was washing my hands probably 3 months ago when this thing started. So how could you explain that now in the context of psychology? And how can the experts, especially those within the health sector, keep that messaging alive and ensure that you and I stick to it?
Thank you, Tamima. That's really a good question. I agree with what the rest of the team said, that it seems like people are getting back to normal or not the precautions that have been previously been put. But what we are going to see, this doesn't necessarily mean that people are not still experiencing the fear or the anxiety or dealing with the lack of jobs and everything and all the stresses that come with this pandemic. But what usually happens when you're met with a very stressful situation, sometimes the mind just puts up defense mechanisms to help you be able to cope. And that is a case where we are saying, if we start treating this disease like it's just a normal thing, like by the way, then it's going to start treating us abnormally. And I would like to say that there's no health without mental health. So physically, maybe people might be protected, or they might try to go back to their normal daily life routines. However, if psychologically people are not prepared in terms of resiliency, in terms of self-care, in terms of thinking ahead, restructuring their thoughts, then we are going to start seeing these symptoms actually come even post-quarantine or post the disease.
All right, thank you so much for that, Gathoni. We do have Kamar Guled. I had mentioned earlier that we'd have an E+ representative, Kamar Guled, who is a paramedic. He is joining us. She is joining us. Sorry. Hi, Kamar.
Hi, how are you?
I'm fine, thank you.
Kamar Hussein.
I'm so sorry, I apologize. Today we are talking about COVID-19 and health and safety, and how now it has become the new normal, and we need to still keep adhering to all the things that we're being told, because as much as people are not taking it seriously, it is a serious disease. And as a paramedic, I am very sure that you have interacted with people who have been sick with the COVID-19. So I want you to tell us what it's like, because a lot of people are saying, I haven't seen anyone who's sick, I haven't heard of anyone who's died, so how do we know it's real? So tell us how it is on your end.
Thank you. As you said, I am a paramedic. I work for E+, and we evacuate patients, COVID patients. So any person who thinks COVID is not real, I am here to tell you it's real. And we have evacuated patients from facilities, inter-facilities, from private facilities to public facilities. We have patients who are asymptomatic. Most of the population, the Kenyans who we have evacuated, most of them are asymptomatic patients. They do not exhibit symptoms, which makes it hard for most people to actually believe that this person actually has the COVID-19. Yeah.
All right, thank you so much.
Just on that, because I feel like you've raised a very important question. Who gets infected? Because earlier on when this disease started, there was the assumption that it only affects older people. So ideally our older parents, our grandparents. But I kind of feel like in the last few weeks, when I'm watching the government updates, you're hearing children as young as 2 years of age. We are seeing incidences in very young people, 9 years, 10 years, teens. So who does this disease affect, especially now that the world has been dealing with it for almost 6 months?
Thank you, Tamima. When the COVID started, the assumption was the disease affects mostly the people who have, who are old, and the immunities are low compared to, energetic and young people. But you will also realize that even when COVID started, even the young people and the healthy ones were still getting the COVID-19. So there's no specific group of people who we can, comfortably and confidently say that these people are highly susceptible to the disease. But what we know is patients who have, chronic illnesses, like, people who are diabetic, people who are hypertensive, people who have who are immunosuppressed, asthmatic people, any person who has, conditions that predispose them to the COVID-19 are more at risk than the people who have, a clean bill of health. But as I had said earlier, no one is immune from the disease.
And I think it's important for us also just to revisit, because it's June now, we are seeing the weather is changing, it's getting colder. And I kind of feel like it's a joke right now. When you sneeze or when you cough, there's almost shame. It's like the whole room, kila mtu anakukimbia. So I kind of feel like it's very important in this season to reinforce, because we look at some of the symptoms for COVID, and they're very similar to some common flu symptoms. So how then can I make the distinction and actually realize, oh, you know what, this is just a cold, I don't need to get alarmed, or this is just a flu, I don't need to get alarmed. Maybe Simon, you could walk us through that?
Yeah, thank you very much. And I think you had previously asked a very important question about who gets infected. By the end of maybe a year, all of us would have gotten infected. Now, it's like a flu. All of us get a flu, except that we are afraid as health workers that we do not know who, when she or he gets this COVID flu, would progress to what is called severe disease. So just getting the infection alone, about 80% would be walking around very fine. But now there are those 20% we need to look at who get moderate disease, and that 5% who need, for instance, get what a severe disease, and therefore will require higher level of evacuation by Kamar and needing ICU services. Now, what we need to understand is that all of us may get this infection, but how fast you get the infection is what determines whether we overwhelm the health system. Yeah. So, for instance, just to give a small example, if you have 2 ICU beds and you need 3 people now who need the ICU, then you'll have to compromise one. You see, and that's the situation we do not want to get into. We want that for the 2 ICU beds, then we get one person this week who gets away, and then the person next week. As you can see, both of them get ICU treatment, you see. So that's what is called flattening the curve, meaning that the rate at which this infection occurs and the rate at which severe disease is occurring in terms of the number of people does not overwhelm the health system such that we cannot even save not only the ones with COVID, but the ones who will require ICU care, for instance, for other things, you see? So that is the concept. So about getting the infection, we can say actually all of us are susceptible with it. Now, the reason we did restrictions of movement is so that we do not spread the flu fast enough, one, yeah, so that not too many people get etc. And two, the reason for that is to get the health system ready in case the number of patients become too many. And therefore, at the moment, what we should be improving is the health system, including one, improving the referral services, getting more of the Kamar's team ready to be able to evacuate people who will require emergency treatment, and two, getting enough health workers employed and deployed so that they are ready, waiting for you in case there's a surge, and three, getting the facilities ready to manage complications of the disease. So this is what we are really pointing at. What we are saying is that this disease could kill you, but if the hospitals are ready, then the numbers are not too many, we will save everyone. So the aims of lockdowns and curfews is to get everyone ready. But that does not stop people from wearing masks, washing hands, keeping good hygiene, and just generally doing what the medics have instructed the government to instruct people.
Okay, thanks for that, Simon. And I feel like you mentioned a very important phenomena, just flattening the curve, because we know a couple of just last week, Kenyans were livid at their president because they were expecting the curfew to be lifted entirely. Kuna wale walikuwa ready sasa kwenda Mombasa kujivinjari, but then still, Nairobi was kept on a lockdown. And of course, the other areas where we've seen higher incidences of infections are also kept on a lockdown. So in the context of the curfew, let's start with that. So we know that there was the reprieve that now it's been pushed from 7 to 9. But why is it still important to maintain that curfew? Because people will argue life is back to normal. Lift that curfew. Close the bars, but lift that curfew. So for those of you in the health sector, why is it still important to have that curfew in place? I don't know whether Machunda, you want to take this?
Yeah, sure. So I think the first thing is the decision that was made was to practically balance between two things, the health of the people and the economy of the country. And so for us, where we are is that COVID-19 pandemic is actually two crises in one. It's a health crisis and it's an economic crisis across the globe. So basically, the decision to say that we are increasing the curfew from the hours, at least by 2 hours, from 7 to 9, is to allow Kenyans to go to work from morning. And remember, even the morning period was moved from 5 a.m. to 4 a.m. So basically from 4 a.m. up until 8, 9 a.m., where most of the activities go on, is that one, you would be able to allow Kenyans to go through their economic activities as usual, full day's work. And that was important because then now it actually gave a reprieve and a relief to those who were probably limited to up to 4 p.m. and
to start finding their way back home. And then the other thing is that why the curfew remains in place is because, one, remember what happens at night mostly is activities that mainly are around celebratory moods, like reveling in the clubs and all that. And so how would you control people who want to go out and celebrate at this point in time? And remember, given the fact that the disease is yet to be contained, we are at a period where we've recorded the highest number since the disease was first reported in Kenya. In the month of June, we reported over 1,500 cases, and that's just the first half of the month. So you can imagine if it was all blown out. It was all free. You're free to do whatever you want as you were doing previously. The reality is that we'll have an increase in the number of cases now. There's one thing that is very important here, and that's why I'd like to also say that whatever Simon said was actually also very true, that the percent of disease severity is constant across the globe. So if you look at the US, you look at the UK, Spain, Italy, countries that really had very bad numbers in the beginning, is that if your percentage of severe disease is up to 6 to 10%, so if you hit 1 million cases, you're talking of over 100,000 people dying and being in severe critical state that require ICU, intensive care unit, and intensive care. So now, as a country, do we have the capacity to deal with such? That is why the decision had to be made to ensure that for the protection of this percent that is vulnerable to the severe disease, that we do not overwhelm our healthcare system. And so now the directive to have 300-bed isolation beds across all 47 counties in a preparedness for a surge in the number of cases. So the reality is that this nighttime activity had to be controlled because this was going to be a source of great infection to people in the country.
Okay, I think, Joyce, it would be interesting just to hear from Tommy. What measures have Nigerians taken towards now flattening the curve? Because you've had what we are doing in Kenya. We have the curfew in place. We have various stipulations around certain industries which are on a complete lockdown. They cannot operate. And so far as you've heard from the various experts, this has actually paid off because the healthcare system is not overwhelmed. So what's the situation like in Nigeria?
Right, Tamima, thank you. I'd like to take up something that Machanda just shared there. In Nigeria here, we also adopted the same system. So for those who did not understand why we needed to be on lockdown, I like the fact that the reasons, I could listen to everybody and I saw that the reasons were very much the same. But in Nigeria, when we went on lockdown, we went on lockdown for 4 weeks. And particularly in any state where you have a surge. So like in Lagos, when we started having the spike in numbers, Lagos was placed on a lockdown because Ogun State is just the neighbor to Lagos, almost married like a husband and wife, they had to lock Ogun State as well. And then Abuja was another place that had a surge. So when Kano also had a surge and mysterious deaths, they were placed on lockdown. Now, when the government was going to start easing, they started by saying go to work at 9 o'clock in the morning and close at 3. Okay, and then a curfew started from 8 p.m. and ends at 6 in the morning. After 2 weeks of practicing that and seeing how it worked, Nigeria graduated, as it were, to 10 to 4 a.m. Now, in a place like Lagos, Lagos is the place, the commercial hub of Nigeria. So when you say people should go home and be home by 10, you're basically saying they should leave their workplaces, say 5. At the most. You're saying that by 10, they shouldn't be on the street. Yes, there has been some measure of compliance with that, but those are some of the things government did. So our curfews are kind of similar. You're getting me now? Now, when it came to workplaces, the workplaces were also given the instruction to have only 40% of capacity. So what it means is on a construction site, for example, the construction workers were the first set of people to resume back. On a construction site, you're meant to have only 40% of your staff. So if you are supposed to have the builders, you're supposed to have the mixers, or you're supposed to have the architects, everybody, you need just 40%. So 40% of that means that if you have 100, you have just 40. which means your projects are going to be slowed down. But that's the measure, and that's what they needed to do. Same applies to the banks. The government offices, the only level 13 and above were asked to resume. So everybody in the lower cadre had to stay at home and work from home, continue working from home. So government did all of that. But then the clamor came for churches to reopen. If markets have been opened, then churches can also reopen. So government started saying, okay, so if you want to open up churches, you have to re-register. You have to do only 1 hour service, okay? Only 1 hour service. You have to open only on Sundays, and then you have to open with only 40% of your full capacity. So if you have a church that could seat like say 5,000 people, the highest number you can have, according to the guideline, is just 500. Have we seen people obey? So now, with all of these measures, you're meant to use your face mask. You're meant to have things like a washing facility in front of the church, temperature checking machines out there. But have we seen people, obey? The interesting part is the week it was said, that was 2 weeks ago on Sunday in Abuja. That same week, we saw that people went to church, open gathering, but majority, 70% of those who were in that congregation had no face mask on. So now that calls for question. Are people going to obey the guidelines? Yes, the government has set the bar and said, this is what you must do. But are people going to obey the guideline? And then I think it all boils down to what we're talking about. People do not care about their safety as much as they care about their stomach.
And Gathoni,
well, that sounds like an African proverb. People do not care about their safety as much as they do about their stomachs. I'm curious, Tommy, are schools open in Nigeria?
Okay, so that's another conversation. You know that schools are not yet open, but we've been doing virtual lessons. Now the proprietors have been questioning the government and the rationale behind locking up schools. Like the private schools believe that they have the capacity to handle safety, when it comes to COVID-19. They believe that they have the capacity, they can save the children, they can keep them safe, they will check their temperature, they will make sure they use hand sanitizers, wash their hands and all of that. But which parents, would allow their kid go to school when you're talking about COVID-19? That's the question here. But private schools want to reopen. In tertiary organizations, tertiary institutions have been, clamoring for this. But the part about Nigeria, Tamima, is the fact that we are short of isolation centers. Nigeria has about 16,658 cases as of last night. And we've recorded about 424 deaths. So you're looking at a huge spike. The more we test, the more we discover. Now, the people who are critical, also means that the maths of Machanda works, because you're looking at 6% of that, being critical. Some of them survive. Just yesterday, we lost a senator in Nigeria here, in Lagos, as a matter of fact, to COVID-19. Just yesterday. It was critical. Now, we look at all of these things that are being done. In the House, in the Senate, you wear the face mask and all of that. But you cannot imagine, despite all of the measures that are being put in place, yet people are saying open up schools. But we don't have isolation centers. So if there is a further spike, as it were, the government has said it anyway, that it may get to a point where you're going to be isolated in your house. If you have a mild case of COVID-19, you're going to be isolated at home, and that's happening already. All the centers are full. All the isolation centers are full. And the government is calling on private schools, calling on hotels to please give them their facilities so that they could use as isolation centers.
All right.
Thank you for that, Tommy.
Gathoni, I would like to engage you on something. When it comes to, this has become the new normal, and there are few people who've been told to go back to work. But like as Tommy said, why would someone even want to take their children back to school if, there's still COVID-19 out there? And I'm sure a lot of people feel that way about going back to work or going back to business as usual. Like, how do you talk to such people? Sorry, you're on mute. Unmute, please.
I'm like, the first thing that I always like to emphasize is that we are never going to get to a point where everything will go to normal or the way things were. Rather, we are looking at a situation where we have to adapt to the new changes that we have. At some point, people will have to go back to school or go back to work, like we are seeing that. But then that cannot happen if people are not psychologically prepared, or if the level of mental resilience is not properly built. Because what I had said earlier is that there is still a lot of stressors and anxiety that are underlying, and the risk factors for people are different because that depends on, for example, if you have any other underlying issues, if you've ever experienced any other stress before, that is what is going to determine how you're going to react now. So at the bottom line is mental health is as important as physical health, and when you work on that, on your mental health, then I would say that it is easier to even actually protect yourself where the physical illness is concerned. It's easier for you to actually say, let me adhere to this, because if I adhere, for example, to what has been put the government, what the doctors have instructed the government for people to do, then you're going to be in a better situation. You're also going to be in a better situation in regards to how do you protect your neighbor. The isolation itself, for example, when you look at the family setup, there is what is called like cabin fever, because people are at home. Depending on the state of your current mental health, that will determine how prepared are you or emotionally ready to deal with some of the conflicts that are going to arise within the family setup. So when we look at the recent trends, you'll find that maybe there is an increase of like domestic cases. There's an increase in suicides or suicidal ideations, panic attacks. Those are some of the cases that we are getting every day at the hospital. So just to emphasize on the fact that it is important that as we are looking into the physical measures, that we also look at the mental health part of ourselves when we are looking at holistically being, whole.
Okay, Gadoni, thank you for that. Just looking at some of people who are actually just streaming live and just shouting them out. We have Bonjarito Ambua, Jacqueline Mwenda, Shiro Seisha, Emily Kang, Ruth from Nairobi, Rebecca Mora. And there's a very good question here from Nyanchama Makori, which touches on what you were talking about, home care. So we've seen that now the government is actually discussing this. And obviously, we're expecting some very specific communication to the public, because now they are realizing that this is a macro issue. It's not just something that you can say, ni shida ya madaktari, shida ya the nurses. This is a disease that requires each and every person to actually marshal themselves. So now we are seeing a scenario where they're saying some people don't necessarily have to go and get treated in the hospitals. They can actually handle some form of self-care or self-treatment in the homes. So Simon, what does this mean?
Thank you very much. And the Nigeria situation actually mirrors what your question is alluding to. So initially, when COVID initially came to the country, and in this country was about, I think, March 16, the aim was to ensure that within 14 to 21 days, there is no COVID in the country, meaning that those with COVID, you put them in a place, they heal, and COVID gets finished, and you don't get transmission to the
at all.
And now, so those measures were put so that just to ensure that none of the COVID, because COVID was imported, it came from outside, a disease that came from outside. So the initial measures, and you see in the first month, was get those people who are flying in, put them somewhere so that the disease naturally gets finished and it's not transmitted. Unfortunately, for various reasons, COVID now managed to get into the community. And once COVID gets into the community, then the growth is exponential. And when you actually look at the Kenya curve, it is actually faster than some of the other places that experienced a COVID surge. And actually, we are going to add surge. When you're talking of flattening the curve, as we are on the upside of the curve.
So we are yet to hit the peak.
Yes, we are yet to
hit the peak infection rate.
No, you're not there yet.
Yeah.
We're not there. So the process was identify, isolate, and treat. You see, but now the numbers are too many, because now, even as the Nigeria case, the isolation centers that we had are full, and they were dedicated mainly in Mombasa and Nairobi. So you had Mbagathi, Kenyatta, and Kenyatta University, but now are full, and therefore now with these big numbers, you have to change tact. You are saying now that anyone with a mild disease, so to speak, then can now as well go home and stay there. But that is not because it is the better option. It is because there is no alternative. Because the danger of home is transmission. You see, now when people go
family members,
yeah, people are giving high fives. Oh, sorry. But you see, that's how transmission is occurring, and therefore we have actually come up with guidelines of home-based isolation. The guidelines have been disseminated recently, I think last week, by the government on home-based, and some of the conditions are given now. We had the Kenya Medical Association giving the county experiences of Baringo this Friday. And it's very interesting, actually, in the rural areas, home-based isolation has actually been practiced even before the government gave this specification, because in certain places, for instance, in Baringo, houses, traditional African houses, are actually made with like a separate area, which can be used as an isolation. For boys, for instance, used to be like the circumcision area, separate from that. And that's
exactly.
Those have actually been used as the home-based isolation area. So if someone is identified in those rural areas, they were actually not being taken to isolation centers. They were being isolated in the home, but in the separate areas. And sort of we may need to borrow.
Okay, I think we have Sasan Feshai all the way from Nigeria with us. And as we are talking about home-based care, Sasan is actually someone who has lived through COVID-19. He was, he tested positive. So Seshan, I don't know, could you please tell us about your experience? When did you know you had COVID-19? How was the treatment process, the recovery process? And another important question, because we're seeing this playing out in most African countries, the stigma. Do you feel stigmatized as someone who previously had COVID-19?
Hello.
Hey, Seshan, can you hear me?
Can you hear me?
Yes, we can.
Yes, we can.
We can.
Oh, okay. I'd like to correct you. I don't live in Nigeria.
Mm-hmm.
I live in the United Kingdom.
Oh, wow.
I work as a nurse assistant.
Okay.
Yeah, it all started in the middle of March. After work, I got home. I felt feverish and a little bit of cough. So immediately I went to get some ginger and garlic and lime. So I started taking that, and for 2-3 days, didn't change. Then I think we were at the peak here in the UK then, because I could remember when I called the hospital, they asked me if I'm still breathing. I said yes, and they asked me that I should just isolate myself, because the hospital and the isolation center has been overwhelmed already. So you just have to stay in your house, isolate yourself for some days. So that's how it started. And I started taking the lime and garlic and everything. I took it for about 2, 3, 4 weeks. Still remained the same. Then I took so many things anyway. I took black seed oil with honey, fever tablet that I got from Nigeria. So basically, I treated the symptoms differently. I treated them the way
because
they come.
You're a nurse.
Yeah. So and what I did was I tried to boost my immune system. Which lasted for about 8 weeks. And I am pre-diabetic. So that's why it took long to go. I'm pre-diabetic. So all I noticed that I've been getting one symptom to another. So, with the help of the medication and everything, I overcame it, but it wasn't easy. It was a tough journey. It wasn't easy at all. Because I spent like 8 to 9 weeks battling it. It wasn't easy for me at all. That's all I did. I isolated myself. I was indoor for those period of time, and I took a home remedy, and that's all. And now I'm okay now, ready to go back. I've been back to work, but these some things I have to be, home again because I saw some other things. But that's just my experience about it. It has not been easy. But
So, Sesan, what you're saying is that self-isolation and home care worked for you. You didn't once go to a hospital.
yeah, I tried going to the hospital. Like I said, the hospital was overwhelmed then. Like there's no space anymore.
There's no
space anymore. Yeah. Because what the NHS here got to do then was to prioritize. Like when you call them that okay, you are sick, you're having some symptoms, and they ask you, hope you are still breathing. Because those people that were in hospital then, those people that are in ICU.
I think anytime you say they asked you, are you still breathing? We all crack up.
Yeah. It's not funny. That's the reality. That's the fact.
Yeah.
They actually ask you, are you still breathing?
They just want to know. Because the hospital was full then with people that got respiratory problem. That's just the fact. So they believe if you are still breathing, you can still cope at home with home remedy.
Okay.
That's just it. Yeah. But
and
now
obviously,
hello?
Yeah, just keep going.
Yes, but I think for now, things are become normal. People are starting going out. Shops are opening now. So I don't know, maybe because of the weather. Might be because of the weather. Because I used to check before. I checked my my local government. I check every day. They update infected people every day. So I check the way it increase like fire, like. So I can't just imagine if it's still going on like that. But for now, it has reduced a lot.
Okay, thank you so much, Sasan. And probably just let me throw this to you, Simon. And he's mentioned a very important fact, the weather. We know now it's cold. So is the fact that we're going into the cold season going to affect the rate of infection?
Yeah, Fefan brought out two important things before I go to the weather. One of teleconsultation. Teleconsultation now occurs. Now people start consulting on telephone, like when a doctor calls you and asks you, are you still breathing? That is teleconsultation, meaning that on a normal day, you would be near them and they are checking whether you're breathing. But now, and because and brings out the second point I want to bring. You heard that he said he went to hospital and they had no space for him. He is lucky that he did not deteriorate enough to need now hospitalization, because now if he went to hospital, the hospital is full, he'd have died. Let's say this is the situation we want to avoid, and by taking these measures. So and now in terms of the weather, SARS-CoV-2, that's the name of the virus that causes COVID-19, is a new illness. So even the factors that are affecting it are still being studied. And that's the difficulty of this COVID, because you do not know its long-term effects. You do not know, is it the way? People had said, oh, Africa, warm, temperature. But Brazil has the same conditions like Africa. The numbers are crazy. So it's a new disease, and we will see whether in future that was the weather contribute.
But Tamima, if I may just spot in there, talking about home remedy, because we have people watching us all over. Now the interesting part is that we must draw from this conversation is the fact that Chesson is a nurse assistant. He's already a medical personnel, so he knows what to take that will not be harmful to his body, He knew what to take, whether home remedy or tablet, that will be beneficial to boost his immune system. Something happened here in Nigeria. A lot of people went crazy with the social media remedy. Yeah. And a lot of people started taking all sorts of herbs, all sorts of drugs, all sorts of things, hot water bath. And we had people actually die from self-therapy. They didn't have COVID. They were trying to prevent COVID. Now, I had somebody who had to send a message in, watched our conversation and sent a message in and said she almost died. In fact, her system had almost collapsed. When she was rushed to the hospital, the doctor now said, what have you been doing to yourself? You were healthy. And she said, okay, she's been taking all sorts of herbs that people had been saying on social media. She's been bathing herself with a lot of hot water, eating up her system and staying in a very heated environment just to save herself from COVID, despite the fact that she's not been going out. And so her system almost collapsed. But she's just in the recovery process now. So as much as we're saying that home therapy does work, we're talking about people who have COVID. And please, even that, you need consultation for that.
Yes, thank you so much for that, Thomasin. We are about to wind up. Sorry.
Want to say something?
Sorry, I wanted to just to add something on stigma. When you look at the situation here in Kenya, the cases that have happened of people who had COVID, we've seen like burials happening in the middle of the night, like at 2 a.m. We've also seen that maybe relatives traveling all the way for a funeral, but then they are not allowed within that vicinity. So stigma is really, really a big one. And I would just like to say that if we can be able to get to a place where we can separate between the illness itself and the human being, then we'll be able to offer support to anybody who has the illness or who has gone through any form of stigma. I'm just wondering if you encountered any personal stigma or social stigma, like when you went back to work. I'm just wondering if you can tell maybe the people, how did you deal with that?
No, there's nothing like that at all, because almost everybody in this country had symptoms of it. So yeah, like 70% of my friends complained about everything I complained about. Like they had fever, they had cold, we resorted to home remedy as well, like me. So, and living the Western world is not practice here. Not practice here at all. Yeah, you say what's in your mind, and people don't stigmatize you or stereotype you. So it's quite different from Africa.
All right, we are about to wind up, guys. So maybe we can have some parting shots with each of you. Maybe we start with Kamar. We haven't heard much from you today.
Okay, I think it's better we try as much as we can to be safe out there. We are the people who can tell our fellow Kenyans, our colleagues, our friends, our family members on the severity of the situation at hand. Like the people who don't. I know as much as hard as it is for someone to wear a mask throughout, it's better to have that mask on. It's for your own safety. And your safety means your family's safety, your colleagues' safety. For example, the company E+, the company that I work for, is a big company. It is the largest ambulance service provider in the country. So imagine putting myself at risk. What would happen to the rest of my colleagues? So safety starts with you. And if the more you can encourage people, the more you can educate people on the COVID, the symptoms, the management, the do's and the don'ts would go a long way.
It's a very important point. Safety comes first. I would just like to thank each and every one of you panelists and experts for joining us today on Shaping African Conversations. But unfortunately, our time together is done. Unless, Tamima, do you have some parting shots?
No, I think just to echo what everyone has said, COVID-19 is real. COVID-19 is here. And even in as much as we are still trying to chase some semblance of normalcy, we just have to remember that when you protect yourself, you protect your community. And you've heard it from all the experts. is, COVID-19 it requires all of us to participate. It's not just something that for the doctors and the nurses and the government. No, me, you, your children, your grandparents, your father, your mother, your boyfriend, we must all participate to make sure that we are protecting our community. As always, thank you guys for joining us on the live stream. We're going to be here again next week, same time, same place. Feel free to suggest any topics that you might want us to cover. And again, Joyce, thank you so much for sitting in today, and for everyone else who joined us on today's episode. Thank you so much. Yeah, so wishing you the best. Stay safe out there.
All right.
Thank you.